Morning, Judge.
Good morning, Mr. Bennett.
Can you hear me?
I can.
Yes.
Oh, good. I did it.
You did. All right. So then we're waiting on, well, we had Mr. Osman and we don't, Mr. Osman or Usman?
It's doctor, and I think, yeah, it's
I had
Osmond.
him for a second. There he is. Is it Osman or?
Yes, sir.
All right, Dr. Osman. All right.
Okay.
And we're waiting for, all right. This is cause number CR21-163, the state of Texas versus Tristan Taylor. And it's on the request to continue or continue the commitment in this matter. And this hearing is being held via Zoom and broadcast on YouTube in order to comply with the open court doctrine. I have received the trial competency evaluation report of October 25th, 2000, date evaluation October 25th, 2024, data report October 28th, 2024, as well as the doctor's certificate of medical examination in this matter, dated and signed on November 5th, 2024.
Charette.
Good morning. I just wanted to let you guys know that, there they go. Miss Nash has Mr. Taylor with her.
All right, so noted, and we have not, we'll begin the hearing at this time, and I'll note that all parties again are present by Zoom. I was just going over, for the record, the documents that the court has before it thus far, the November 9th letter, and also the evaluation dated October 28th, 2024, and the physician's report or certificate of medical examination for mental illness dated November 5th, 2024 in this matter, and then on November 15th, 2024.
I believe that's correct, Judge. I believe there's two CME
Yes.
or the certificate of medical examination.
Yes,
There's
that's
two of
correct.
those.
Yes.
Okay. May I proceed, Judge?
Yes, you may.
Thank you, Judge. Basically, based upon the report, Judge, in those CMEs, what the hospital is telling us is that Mr. Taylor is unlikely to be restored right now due to severe mental illness. And Dr. Osmond is here. I believe he's the treating psychiatrist. And if Dr. Osmond, if you would provide some testimony to the court about what it is that you're seeing and experiencing with Mr. Taylor.
All right. All right. You may do, Ms. Nielsen, do you have anything to add right now?
If we could swear in Dr. Osmond, I do have a couple questions of him.
Very good. All right, Dr. Osmond, if you'll raise your right hand. You do solemnly swear, promise, or affirm testimony you give in the case pending before the courts be the truth, the whole truth, and nothing but the truth, so help you God.
Yes, I do.
All right, Mr. Bennett, you may proceed.
Thank you. Dr. Osmond, would you state your name for the record?
Osama T. Osman.
And how are you employed, Dr. Osmond?
I'm employed by the University of Texas here in Houston Health Science Center at the McGovern Medical School as a full professor of psychiatry. And we're contracted through the state to provide services at Rusk State Hospital.
And are you currently treating Mr. Taylor?
Yes, Mr. Taylor is one of my patients.
And would you describe your experience with Mr. Taylor?
It's a good experience. He's a good man, very nice person. I enjoyed working with him very much, and he's making progress.
He is making progress, but I believe
he's doing his best. He's doing his best to try to cooperate.
Mm-hmm.
He's a nice
And
man.
uh, uh, but is it your opinion that he suffers from a mental illness?
Yes, he does, sir. Yes, he does. He has schizoaffective disorder, bipolar type, and he also has some intellectual disability, mild.
And is that hindering his restoration right now? COMC restoration?
Yes, sir.
I believe in your report or your medical examination, is it your recommendation that he remain in a facility?
Yeah, he's making some progress, and I think if he remains in the facility, we can probably help him some more to get stable, to have some consistent stabilization of his psychotic symptoms, and to find him some less restrictive placement, then that would still be supervised and structured enough for his condition.
If he was released today, would he be a danger to himself or others?
Yes, now he's really nice, but yeah, I would be very concerned that he can regress very rapidly and can end up hurting himself or somebody else.
I'll pass the witness, Judge.
Ms. Nielsen.
Thank you, Judge. Dr. Osmond, you and I spoke last Friday night, correct?
Yes.
Okay, and we talked about medications and things like that that generally are prescribed, or at some point you find the correct, I guess the word is cocktail, for the schizoaffective disorder and the bipolar, but it's not a one size fits all, correct?
That's correct.
Okay, but you did find something that is helping with those symptoms, at least for Mr. Taylor, correct?
Yes, he is in polypharmacy with some medication, and he seemed to be stabilizing.
Okay, and he's compliant with his medication?
Oh, yeah, he has been good. He has been very good with that, with his compliance, because it's court ordered. But I fear that releasing him to a non-structured setting will end up with him not being able to follow up on his medication intake and will end up relapsing.
I understand. And a lot of that, I mean, apart from those two diagnoses, some of that has to do with his underlying mental disability, intellectual disability, I guess.
I think it's mostly related to his primary psychiatric illness of schizoaffective disorder, bipolar type, because it has a component of psychosis that include a lot of paranoid ideation, paranoid delusional thinking, and sometimes he imagines things that aren't there that end up being, and he end up acting on it and becoming really danger to others. So his reality testing is severely impaired, but he is doing good now. He's doing the best he can.
Very, very cooperative. And is he attending
He's not
meetings?
he's not attending his competency class, and this is what I'm hoping to do, that with your encouragement for him to attend his competency classes on a regular basis, maybe we can get some information for him to restore his competence. But he's doing his best. Sometimes he attends some activities that involve food and snacks and some fun activities that we have. But for the competency classes, he's not consistent with attending that.
Have you had patients in the past, in your experience, with similar or the same diagnoses and maybe underlying intellectual disabilities that have progressed to the point where there might be a facility, a structured facility that they could, move into?
Yeah, I guess there are two components to that. Whether he can be restored in his competency is one component. The other one is, if he is not restorable, would he fit somewhere in a less restrictive but structured still activity? There are some state facilities for people with dual diagnosis, developmental disabilities and mental illness. but we're trying to see if he would be eligible for it because his intellectual disability diagnosis has to be established before age 18. The testings and the documentation have to be there before a certain age, and I'm not sure if he qualifies for that. But we're working with the social worker to see if we can find him a less restrictive but still very structured environment.
But at this point, he's not, he's not eligible for that type of thing.
No, we did not find that placement for him yet. And this is probably the least restrictive, safe environment for him at this point to stay in the hospital.
Okay, and that's been discussed with him, correct?
We have him in treatment team meetings, and he does the best he can to understand what's going on.
Okay.
But we've discussed with him that we need him to stay with us and do as good as he is doing with his compliance with the medication, not getting too violent or aggressive, and not getting too paranoid, and just continue to have conversation with the staff when he's uncomfortable.
Okay. But you found him to be a fairly pleasant individual and
Very
receptive.
nice, very polite, very pleasant. Yes. It's just that when he gets paranoid, ma'am, when he gets paranoid, he is just completely out of touch with reality, and he ends up acting out very violently sometimes, but otherwise he's really nice.
Okay, thank you. I'll pass the witness.
Ms. Bennett.
Dr. Osmond, would a year be enough to kind of stabilize Mr. Taylor?
Sorry, sir. I didn't hear you. Sorry.
I'm sorry. Would a year be enough to stabilize Mr. Taylor and possibly see if he can be restored to competency?
Well, it will give us an opportunity to try that because he has made some significant improvement in the past year or so since I had him. He used to be extremely violent. He would assault staff all the time for minor reasons when he gets paranoid. He stopped doing that now. He's really nice now. He's just, sometimes when he gets upset, he makes verbal threats, but then he calms down after he gets some snacks. But he's really, he is very vulnerable to acting out, but he has made some improvements. So I'm hoping that in the next year, this improvement will continue to be consistent. If we can encourage him to go to classes to learn some more skills to apply it, that would be of benefit. So
Okay.
yes, I would think that it would help to keep him longer for another year.
For another year. Okay. And I
But
believe
if
you
you
just said,
stabilize, sir, if you stabilize before that and we find some alternative placements that are suitable, we'll certainly immediately release into a lesser restrictive environment that's still structured.
absolutely. Absolutely. And I believe you said he's been under your care for a year now?
Yes, sir.
Okay. I'll pass the witness, Judge.
Ms.
I have
Nielsen.
no further questions. Can I briefly inquire of my client?
Yes.
Okay. Mr. Taylor, do you understand everything that's, actually, I think he's muted. Is there someone there that can unmute him? So, okay, great. Mr. Taylor, you've been listening to the doctor, right? That's okay. He has a lot of good things to say about you, Mr. Taylor. I've heard a lot of good things about you.
Yes, the court has too.
And do you understand, Mr. Taylor? We have your best interest, all of us have your best interest in mind. You understand?
Yes, ma'am.
Would you be more comfortable if I talked to you after this with just Charette and you or Cheyenne and you? Would that be okay? Could I talk to you then?
Okay.
Okay, well, let's try it that way then. Okay, sir? Okay, I'll do that. Thank you very much. That's all I have, Your Honor.
Judge, I'm gonna request a year commitment. Mr. Taylor seems to have made a lot of good progress, and if we stop now, we would probably lose everything we've worked for, that everybody's worked for. And Dr. Osmond's, all his efforts and time would have been kind of just wasted. So I'm going to ask for an order that commits Mr. Taylor for a year. And as Dr. Osmond has pointed out, once he's stabilized enough to go to a less restrictive setting, that's always an option.
Any objection to that, Ms. Nielsen?
There's no objection, particularly since Dr. Osmond said if he makes progress prior to the end of a year that, we can look at a different facility for Mr. Taylor.
He can always,
He said, would he be able to go home?
we hope so at some point in time, not today, though. Mr. Taylor, this is Judge Gossett. And first of all, we're all very happy and proud of the progress that you have made. Everybody feels like you're doing real well. We want you to continue to progress. And that's what we all want, is what's best for you. And right now, it's going to be to continue with the treatment that you're getting. And we all want to encourage you to really try to make and attend all of your classes and all of your activities, because the more you participate in these classes, the more you are attending these activities, this will help you get better and to hopefully return home, okay?
uh,
And I'm gonna let you talk with Miss Nelson when we get through. She's doing a great job on your behalf. All right, the court, based upon and I'm taking judicial notice of the contents of the documents I heretofore referred to. When the court is of the opinion, that based on the evidence before it, the defendant is mentally ill and does meet the criteria for inpatient commitment. And he is likely to, if released, would likely to cause serious harm to himself or to others, and suffers severe abnormal emotional or physical distress and substantial mental or physical deterioration, is not able to make rational, informed decisions concerning his treatment, and therefore the court orders, based upon this, a continued inpatient treatment for a period of 12 months, with the understanding that should Mr. Taylor at some point in time demonstrate the ability to receive less intrusive treatment, that they'll certainly be considered by all.
Thank you, Judge.
All
Thank
right,
you, Judge.
Ms. Nielsen,
Yes, sir.
I am going to mute myself. I'm trying to figure, I'm gonna turn my volume down as all well. I'm sure that I don't know that I have the ability to do the breakout rooms. Let me look and see. Breakout rooms. All right, I'm going to, let's see if this. Ms. Button, would you come here, please? All right, I am Miss Nielsen.
Then they log off, Your Honor.
I think I can do this. Well, Cheyenne Nash and Cheyenne Nash.
So Cheyenne's gonna have to join.
All right, I think I've done it.
I think so, Judge. Do you need anything else from me, Judge? Because I
No.
think I can leave the
We're
Zoom.
discussing these matters.
Thank you, Judge.
Thank y'all. Thank you, Doctor. All right, I need you to go pick up our.
Want me to bring them up or can I leave them in the car?
Yes, what about,
Is it on your calendar?
it's still on my calendar for 10:30. 10:30. Yeah. It was off on the computer this morning. I called Shoemate's office and checked, so. Heather. Please. Yes. Is that Mark? Yes. Okay, fine. I'll be there. Okay. Tell you what.
Good times and everything. Are you gonna meet me out there or you want me to come back up here?
What time's
11.
Yeah, you can just come back there. You're gonna go there.
Go there?
Yeah.
No. That's not right.
Take that home with you.
Yeah.
Yeah. Judge's office.
Hi, this is Claire Hunt. I had called about a case, I think maybe last week. It's an appeal that I was appointed on by judge, but it's a writ of habeas corpus, and I did a kind of a brief person last year, and there's really not much anything I can do on it anymore. And the client is sending letters, he's understandably irritated, because there's not really anything to be done. So I wasn't really sure what I'm supposed to still be doing on it, or if I should file a motion to withdraw, or.
Claire, this is Judge. Yeah, just file a motion to withdraw.
Hey, Judge, thank you. I'm sorry about that.
No,
I kind of held on to it for like a year. What to do?
no, that'll be fine. Yeah, just file that and you can tell them you're no longer involved in the case.
Okay, all right. Thank you so much. I
Thank
appreciate
you, Claire. Have a good day.
it. Thank you. Merry Christmas.
You too.